Hello BCMT class 2024. Guys, this is our lecture for today. It's all about the first aid. So our instructor for today is Mr. Jonathan Angana. So we are ready to learn about the first aid and immediate care. Our objective for first aid is to eliminate pain, prevent more injuries, and prolong life. He mentioned also the types of wound, which is the open and closed wound. So this is how to control the bleeding, no? Of course, you have to elevate it and wash water, not alcohol, guys. And now we are ready to learn the sprain and strain, and of course, the more important is CPR.
Then, insert. Nana ni eyes, kabutan. Hinay-hinay nga paghugot. Dili ka na yung paghugot, ha? Sakit na kayo na. Masipaan ka sa pasyente. Okay, kasakit. So, hinay na siya. Then, square. Sprain. Na-sprain. Ankle. Recheck ka sa pulse. PMS. Pag-check ni mo sa pulse, nawala mo niyang pulso. I-check ni mo ang motor sa ilihok daw. Hindi na niya ma-move. Pag kusin ni mo di sa ka-feel, meaning, hugot kayo ang imong pagbaat. Fracture or dislocation na siya elbow ang injury. Age, imo siyang bedman. So, imo siyang immobilize para siyang dili ma-straight. Ikan, then direport sa silong. Then, i-X na po na siya nimo, parang dili mag-move. Then, isa sa silong, isa sa taas, then square knot. Okay. So pag square knot, na-immobilize na ni siya eyes. So sa kung saan niya naglihok, sa kasakit, di niya na ma-straight. Yan na, straight ba? So di niya ma-straight. Dili na siya arm sling. So arm sling, pwede mo siya i-arm sling. Secure na siya. Dili na siya makon sa ang imong patient na immobilize na sling. Kuming belt siya or light triangular bandage, technique sa sling sa triangular bandage na pwede rin siya sulod rin mo na muna sa belt type sulod then kanara siya.
Mas easy.
Para mo bitay din siya. Nakangol siya. Ini kayak padala ka sa ospital sige pang gawid ana, di ba? Okay. Nakuha. Yes sir. So, bago na pagkuron ka, daram din sa iyo siya. I-stabilize lang ang object. Kung ga-bleed siya, butang ang mga gauze pads or any cloth, diri nga makontrol ang bleeding, parang dili mag-move ang object, so ato siyang i-stabilize, i-immobilize siya. Kung taas kayo ang object, before ka mo cut sa object, naka-immobilize na siya. Ito ba mo secure. So, conscious naman yung pasyente, nakakamot mo siya. Mura niya siya forma. And, hindi mo na lang ibaan sa taas. Nakuha. Sayang. Mostly, nag-choking ang tao, responsive pa siya. Makaupo pa ka. Lingoy ko na. Apply 5 back slap or back blows. Secure niyo mo siya, patindogon niyo mo ang patient. Dirita, center, shoulder blade, center of the shoulder blade, between the shoulder blade. Kini back blows, then sa nimo kamay. One nimo, imong lang taon, di ba sila ignatag? 2, ikon sa patient. Transfer, sa pabalikarong kamay. Pagitaon mo yung pusod, hit the navel sa patient, make a fist yung isang kamot, just above. This is the abdominal thrust. Inward, upward, i-scope ni mo. 1, 5 times yung ball. 2, kusog. 3, ni mo, saka ni mo, ang air, ipasaka ang air, nisaka, kay sige ni mo gidoon, ang obstruction dire, gitulod sa air. Nakuha ninyo? Gitulod sa air, nagin siya yung obstruction. So, assist the patient, the airway, head tail, chin leaf. Managin siya mo. Open the mouth. Kung nakita ang object, utol. Ganoon, twice. Sino na umaak? 1, 2. Wala pag yun makuha. Nanong twice airway, nanapay mong gawas ng blood the nose, mouth to mouth. Bugaan ni mo hangin, tagaan ni mo hangin. Dili ni mo suyupan kay galis. Breath. Maglantaw ka dire kay kung ni rise and fall, pag-open mo sa airway, wala kay nakitang object, dili ka pwede mo abdominal thrust sa unconscious.
Dili pwede sir.
Level, abdominal thrust unresponsive. One. Sumura kag abdominal CPR pero look at po ni mong level, ibabaw.
Babaw.
1, 2, 3, 4, 5. After 5 abdominal thrust, balik ka sa airways. Unresponsive. Kung wala ka sa cervical injury, spine injury, automatic i-open ang airway. Ipahangad, head, tail, chin, leaf, maneuver. The rationale, ganong ipahangad na to ang tao. Open ang airway, move forward ang dila. Kaya kung nakaala rin niyang posisyon na ni collapse, pwede siyang dili kaginhawa, kay muukok iya ang dila. Bukang cross, mo-open, buga ni mo, then munganga siya, open ang airway gamay, unconscious man ka. Rise and fall na yan. Unresponsive gid siya, diretso ta unresponsive. Open ang airway, check the pulse. Dili ka pwede mo ana dito sa pin counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. No pulse. So, while ka-check ka sa pulse, galantaw mo kasi ang check. So, ang imong buhaton is CPR. Center of the chest, heel of your hand, 30 compression, 5 cycles, 2 breaths. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9. Pero kung tinood 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20. 1, 2, 3, 4, 5, 6. Open the airway, head tail, pinch the nose, mouth to mouth. 1, 2. Hindi mo sige bugaan o kagin. Then balik compression. Kalima, 5 ka 30. 1, 2, 3. That is whole flow. Kung muhatag ta og breathing. Whole flow sa CPR. Now, what if hands only lang ang atong gamiton kay dili ka ganahan mo to mouth kay wala kay lang. Sir, unresponsive. Sir, wala gid siya unresponsive. Check sa pulse. Wala. Unresponsive patient, call for help. Call gid ambulance. Then compression ra ka 120. Ang imong i-compress. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 1, 2, 4, 5. Kay pag-collapse niya, pag totally unresponsive sa tao, katong siya sa iyang head, then negative pulse, negative breathing siya. So, diri rataman, possible diri rataman. Experience mo tinuod para maka-feel mo.
30 compression, 5 cycles.
Hindi kidalin. Kapoy nga.
And now guys, we are ready to do our CPR with our mates. So this is it guys. Hey, 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 are you okay? Hey, 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 are you okay? Basic life support guys is very important for us. Everyone should know this. This is a must training for everybody. For me, this is a refresh learning as I am a caregiver. We learn how to do this. First aid is very important for us to know. Our basic life support instructor, Mr. Jonathan Angana, also teach us how to stop while doing CPR. So CPR should continue until you see signs of consciousness. Once you notice signs of consciousness such as movement, breathing, moving, opening of the eyes, or making sounds, you can stop performing CPR and the victim becomes unresponsive again, then you should resume CPR. When to stop the CPR? S stands for stop CPR, T stands for turn over or take over, O stands for operator, already exhausted, and P is physician or personnel is arrived, you have to take over, and S stands for sane is unsafe. And so we call it stops. So ayan, we'll learn a lot for basic life support, CPR as well, choking, and type of wounds, how to stop the bleeding. Ayan, so that's it for today guys. Thank you for our instructor, BLS instructor, Mr. Jonathan Angana. Thank you, sir. BCMT class 2024, we are ready. Thank you for watching.